Plexus are all different nerves. Okay. All right, so then we start looking at your disc. So normally your disc has a whiter center like this one. Normally they get a little bit thicker or taller as you go down. So the nucleus has a higher concentration of water, so that's why it looks whiter there.
Okay.
Overall, these don't look too bad. They get a little bit thicker as you go down. That's normal. Okay. And then we get down to that bottom one and we see quite a bit of narrowing of that bottom disc, L5S1. So severe narrowing, what we call degenerative disc disease down there at the bottom. There's a little bit of a forward slip, like if you look at the back corner of the bone here, that S1, see how this L5 has slipped forward a little bit?
Oh, yeah.
Okay.
Is that the problem?
Let me finish. I think, yes, I think your problem is down here at that bottom level.
Okay.
All right, so over here on the right screen, these are what we call axial images. Essentially, it's a cross-section slice. We're looking from your feet up towards your head. This is your back down here, abdomen, left side's over here, right side over here. And that cursor will let us know exactly where this slice was made. So we're up at that L1-2 disc. And that looks really pretty decent. It's got that whiter signal from the nucleus or center of the disc. The annulus, which is the outer part of the disc, darker here because there's less water. Up in the upper lumbar region, our discs are always a little bit concave on the back side. So this one might be a tiny bit bulged, but really not causing any significant narrowing or compression or anything on the nerves. So it looks really pretty good.
Good.
And we go down to the next disc, which is your L2-3. Right there, and essentially looks basically pretty normal again. I mean, it's maybe lost a little bit of water, but it's certainly not really herniated or bulging. It's not causing any nerve compression or narrowing of significance. All this white in here is the spinal fluid. Darker things scattered through here are your nerves. This is bone, that Y shape. That's that bony bump down the middle of your back. You follow that there. Here's your facet joints. Right side and left over here.
Okay.
So everything looks pretty good up there. Next one down, L3-4 disc. And again, really looks pretty good. Still slightly concave. And as you go down, that degree of concavity normally gets less. So by the time we get down here, it'll probably be just kind of straight across the back, but everything looks good there. I think you have good room for the nerves. Down to the L4-5. Yeah. Looks really normal. There's some arthritis showing up down here in those facet joints. They just look a little bit hypertrophied. Okay. Then down at L5S1, the bottom. Okay, so we got more substantial arthritis, kind of mild to moderate probably in those joints there. And the disc is a little bit bulgy. Okay.
That's L5S1.
Yep.
That's the one.
And it's just, right here, still pretty mild in terms of that kind of protrusion, bulging there. But if we move back over here on the left screen, we're going to scan out to the left and the right side. And we'll scan out to the right side first. I'm going to grab this model. Because what we're going to look at now on the MRI is this area where the nerves come out and exit from the spine. That opening is called the foramen.
Okay.
Okay.
Well, thanks for taking the time to
Oh yeah, no, you're welcome. It's just, so if we move over to the right side, so now we see disc, all the rest of this is bone. That dark center is the nerve, all your nerves, and then the white out here is a little bit of fat, which is there to kind of cushion, protect the nerve. So these look okay up here, but look at this bottom one. There's your nerve right there. So instead of being sort of more of a round thing, you can see how this tunnel is really narrow from top to bottom. It's like up here, it's from top to bottom here, and that's your nerve. And down here, I think there's your nerve right there. Kind of more flattened. See what I'm saying?
Yeah.
That's the right side. Let's see if the left side looks any worse. Yeah, I think the left side might be a little bit worse on that image. This one maybe doesn't look quite so bad. But yeah, it's pretty narrow right there. So that's probably what's causing, the symptoms in your legs, especially down below the knee and stuff. Up in the thigh, anterior thigh or lateral thigh would typically be more up in here. And that looks pretty good up there. But sometimes, things don't always follow the textbook. That one's a little bit. Okay. So that's the main issue. And it looks like you have what we call the pars defect. So you have spondylolisthesis down there. Well, that's not what I wanted to do. Okay.
Does that contribute to my symptoms?
Yeah. Yeah, so you can imagine what happens to this opening as that disc loses height,
Right.
and then this vertebra starts to slide forward, that opening can get fairly small. And that's, I think, what's happening in your case. That would definitely probably what causes the numbness, tingling stuff in your feet.
Yeah.
Okay. So I don't know if we used the board last time, but so down there at L5S1, we've got spondylolisthesis. There should be an E in there. That's that forward slip, and so we would call yours a grade 1, and that grading is based on how far along this S1 surface it slips. So if it's 25% or less, it's a grade 1. From 25 to 50 here would be grade 2, and from 50 to 75 and 3 on. So you're kind of a mild grade 1, okay? And then the other and of course we said you had pretty advanced degenerative disc disease or narrowing at that same disc.
In that one disc?
Yeah. And then you have foraminal stenosis. And that's just the word that we use for narrowing. And that's what's pinching your nerve.
Okay.
So if we talk about treatment, it looks like this. There's non-operative treatment or surgery, right? We just start out big picture, either we operate or we don't. We have our discussion over here. First, the things we have to work with include medications. Non-steroidals like ibuprofen, the steroids, muscle relaxers, analgesics, some of the pain medications such as tramadol. Then there are medications that we sometimes use for nerve pain. Not specifically for that, but the most common one today is gabapentin for sure. Yeah.
Right.
Okay. Physical therapy and exercise. Activity modification, meaning we try to avoid things that aggravate it or modify the way we do things. Injections. Trying to be comprehensive over here. Chiropractic care, and then what we call complementary alternative medicine, all the other lasers, magnets, herbs, acupuncture, ozone. It's a long list and it just keeps getting longer and longer. Okay. I kind of work more up in here. Okay, so that's a big overview for you.
Okay.
I can't remember, have you been to physical therapy for this?
No, not for this.
Okay, so certainly that would be one option. Okay. Medication, we've got some tramadol. Do you take any ibuprofen or anything? I know you were taking some at one.
I do, I have, and with that, with the Tylenol giving me such a painful stomach,
Yeah, okay.
I just, I do take compensatory supplements to help heal the gut. DGL, which it works with the lining of the stomach. It's a licorice-derived supplement, and then Pepsin GI, which is for stomach. Anyway, and then another glutamine. But I don't want to rely too much on
Medication.
Advil and medication.
So gabapentin be an option, I think.
So
Yeah, go ahead.
all these medications, are they to just wait for my body to heal itself? with
Yeah,
this?
somewhat. I mean, this is definitely trying to treat symptoms. It's not going to change the
Condition.
anatomy there, or the condition exactly.
Right.
But some people do really well with gabapentin, and some people don't like the side effects at all. Kind of lethargic-y, tired,
Sure.
just don't like the way it makes them feel.
Right.
But these are all options. So what I tell people, I think my job is to help you understand what you have and what your options are.
Right.
And you decide. Like with the steroid, you said, "Hey, that's not
Yeah.
for me."
Not right now.
Okay. So those are kind of the main ones you could start with there. The injection.
And what would the injection be of?
Yeah, it would be a steroid though. And
I've successfully had that the last time I had this, which was 17 years ago.
yeah. There's a couple of options as to the type of injection. I would probably do an epidural at that L5S1. Okay. So that's one injection kind of in the middle, trying to get medication spreading out to both sides and stuff. So that's outpatient, you walk in, walk out.
Right.
We do it with x-ray guidance, so we prep the area, numb it up,
Right.
bring a needle down to the back of the bone
Right.
here, and then just angle between the two here into what we call the epidural space, inject a little contrast for confirmation of everything, and then follow them with the medication, which would be local anesthetic with a cortisone or steroid, which is of course an anti-inflammatory. Risks are things like infection, allergic reaction, bleeding, headache, all very, very small.
Yeah.
The other option would be, you can do one injection on both sides, and you come down and get right down here beside the nerve like that. But I would probably do the one in the middle, see if we can get medication spreading to both sides and get you some measure of relief that way. It's not going to be like a cure, pain's 100% gone, but
Right.
hopefully we can bring things down to more manageable levels, and then you can either exercise on your own or attend physical therapy.
Okay.
Last resort would be surgery down here.
Tell me about the surgical options.
So with the surgery, they would probably do a fusion in your case, I think, which means they come
Not
in
a,
here. And
not a discectomy?
I don't think it would be just a discectomy, because they really got to open up these foramen and open up that space for the nerve. I think to do that, they're going to take away bone and stuff, and they'll end up wanting to do a fusion. I say they because I'm not a surgeon.
Right.
I don't do the surgery. You could talk to a surgeon, see if they would be considered doing just kind of a foraminotomy, which is opening up that tunnel without a fusion. But with the forward slip, the listhesis, typically they do a fusion.
And what are the consequences of that?
Well, hopefully you'd have significant pain reduction and
Right.
numbness in your legs and stuff like that. The concern about a fusion is that, it puts more stress on the ones that you don't fuse. Fortunately, your other discs look pretty dang good, honestly.
Yeah.
So that's a good thing for you.
So, could I have an injection,
Epidural?
epidural plus the cortisone, right?
Well, it is a steroid.
Okay,
So the epidural injection is a steroid. Yeah,
okay. All I know is an epidural.
yeah.
Okay. And then have a consult with the surgeon?
Uh-huh. Yep, absolutely. So, is there a particular surgeon you have in mind?
Well, Steinhaus would be one, probably.
Okay, yeah, he's one of my partners, so
Oh,
that's
okay.
easy.
Would it? Okay.
Yeah. So we can get you scheduled for the injection. I'm the one who does those. And then maybe
You do the
injections.
Good,
Yeah. And then maybe 2 weeks or so after the injection, we'd want to see how you're gonna respond to that before you see him, I think.
Uh-huh.
Would be good timing.
He-
2 to 3 weeks.
He's out till, I think, May 10th.
I have no idea.
I just checked with the front
Okay.
desk, yeah,
Okay.
if that was an option.
Yeah.
How does that sound to you? hon?
Good. Sounds like a good plan.
Okay, when could we schedule the injection?
To talk